lecture for me at all. From the moment that I pace, I'm a teacher and I'm a pacer, so I hope that this. Okay, I'm gonna try and pace sideways. I'm somebody who's very, very passionate about nursing, and before I start, I wanted to know, are there any nurses or former nurses or active nurses here today? Happy Nurses Week. Yay, nurses. So since I've been invited, from the moment that I got Sean's email, and I sat on it for quite a few days, I have struggled with how I would do a presentation. I can't be like Chris, who I've known for 21 of my 22 nursing years. I can't have some kind of a presentation laid out for me, nor could I really have a PowerPoint. And I wanted to be able to get a message across to you, really what it is that palliative care nurses do and what makes us a little bit different, why I would define myself, even though I've worn a variety of hats across my nursing career, why I would define myself as a palliative care nurse. So, this is an interactive session. And Peter kind of stole some of my thunder as I was talking to him before the lunch. But does anybody remember their first love? Do you remember that first love? Right? Your first love. Do you remember your first love? I mean, it's not something that goes away, right? Now, do you remember your job and what you thought it was going to be like? And you had your rose-colored glasses on, and you knew that this was going to be the job of a lifetime, and then you found out it wasn't necessarily that. Excellent, thank you. Right, so that's not going to work either. I'm going to put it right back there again. So, who has been able to find a job that they love? They love with the same kind of passion, and they remember it just like that first love. Yeah. Okay, that's what palliative care is like for me. It's like coming home. So I've done trauma nursing. I've worked in cardiac sciences. I know that you had Dr. Andrew Hamilton come and speak. I was one of the educators at KGH for a number of years. And I've loved and I've given 110% to every single one of those things. But when I graduated in '90, I found myself in gynecology. That was not my first love. I went to a burns unit, and I heard a lot of people crying in agony. That was not my first love. I worked in neonatal intensive care when the AIDS epidemic was first coming around, and I worked with babies who had been born with AIDS, and I worked with the high-risk babies who were detoxing after their moms had ingested narcotics or heroin. That was not my first love. In 1991, I found palliative care, and I can honestly say that there was something different about it. And I think that for anybody who has a passion about the area that they work in, and you see other people who don't share that love, it's how can you not love this? I think that people who work in palliative care, you have to do it and love it because you can't sustain it. You will burn out. There is something that is so different about being involved with somebody who is going through their death that it would be way too painful if you were not passionate about it. So how do I manage to get you to understand what it is a nurse who's doing palliative care does? Well, nursing in general, when I'm doing an admission in palliative care at St. Mary's, we don't have a very big unit there. We initially started off with 6 beds when I was hired at St. Mary's. Then it expanded to 10 beds, and we have some mumble 14 beds that we don't really call palliative care beds, but they kind of are. There is criteria that we have to use in terms of the patients who are admitted. Usually their life expectancy is less than 3 months. When I am admitting somebody as a patient, I have to give the illusion that I have all the time in the world. But here's the thing, the best kept secret about St. Mary's is that I know that I do. because when I'm looking after those patients, when somebody is being entrusted to me and I am doing that admission, I know I have a team of people who are going to take over my other patients for me. Okay, so here's the part where I hope you did bring Kleenex, because this is the part where I have to bring you to what it is I do so that you can understand what makes palliative care nursing so very special. So I want to take you to an admission I did when I was working with my students from St. Lawrence. I had the opportunity where I wanted to show them how to admit somebody, what kind of information we get, and the kinds of questions that we would do. So this was a patient who was 47 years old, so not that far away from my age, and I have to say that the more your patient is similar to you, the harder it is. So patients who are Black women in their 40s, they're going to remind me of me. Patients who are in their 40s are going to remind me of me. Patients that remind me of my mom because she is from England and feisty. You know, you have to help them to become, you are becoming a member of their family for that brief period of time, so you're finding that connection. So I want you to join me with this patient. He's 47 years old. He's just been transferred over from KGH, where he is being told he's got terminal cancer of the kidneys. And so he comes in, he's transferred onto the bed from the stretcher, and he's paraplegic. So he has developed a spinal cord compression. And so I sit down, he's on his bed, I'm sitting down beside him because I don't want to hover over him. I want to be at the same level with him, and I want to be able to look him in his eyes as I ask him these very, very personal questions, because they are very, very personal. And so one of my students is taking his vital signs, and so the vital signs are taken, and they're all normal. And I said to him, "What brings you here? Can you tell me what it is that you're expecting from St. Mary's of the Lake?" And he starts to cry. Now I can tell you 10 years ago, 15 years ago, I don't know if I would have known what to do with that. And I said, "I see that you're crying. Can you tell me about that?" So this is part of that patient and family-centered care, right? Can you tell me about that? What's going on? I can see that you're crying. And I don't want to judge that he is sad or upset, because then I'm putting my own things onto him. And he says, "I'm so happy to be here." He said, "When I was at KGH, I could not get a physiotherapist." And he said, "And I know I'm terminal." So he said, "I don't want you to think that I'm crazy." He said, "But my goal is to walk out of here." He said, "Terminal means different things to different people. And terminal means to me that I can still fight, and I'm going to." So I took that on board. And during that interview, and believe me, I would not have had this kind of time, it took 2 hours, he told me about the most horrific abuse that he had had as a child. He told me how he had virtually raised himself using funding from the Children's Aid Society. He told me how his father had thrown him up against a wall. He told me how he had paid his aunt every cent that he had had from Children's Aid Society and still had to muck out her stables and live in the barn in order to be able to afford to go to school. But he managed to put himself through high school. This is what it means to be a palliative care nurse. Okay? So this 2 hours that I sat with him, I had to let my students come and go, and different groups of students were listening to the conversation and filtering in and out. And then Dr. Stewart's coming in. And before Dr. Stewart has a chance to even say, "Hello, my name is Dr. Stewart," who's one of our palliative care physicians, I said, "Dr. Stewart, this is our new patient. His goal is to walk out of here. His goal is to get physiotherapy." Now, why wouldn't I challenge a patient about that? Because I have to make a connection with him. We have to be on the same page. Because if I want him to go through that journey with me, or if he wants me to be privileged enough to walk that journey with him, he has to trust me. And I have to meet him exactly where he's at. And so Dr. Stewart said, "Okay, let's get Carr, our physiotherapist, to come up, and we'll see what we can do. And let's get Judy, our occupational therapist, to come up, and let's see what kind of a wheelchair we can get for him." Well, this gentleman lasted maybe 2 months on our unit. And during that time, his father came into the hospital, and his father begged for forgiveness. And again, I was privileged to be able to sit by this patient who asked me to come in and talk to him because he had made that connection with me. And he said, you know, I realized that if I didn't forgive him, it was going to hurt me much more than it was ever going to hurt him. And then later on, about 2 weeks before he died, he called, he heard me going by, talking to one of my students. He said, Marie-Jo, I need you in here. And I came in and I said, what do you need me for? And he said, I just feel safer when you're here. And so I sat down beside him, and we just kind of chatted for, 10 to 15 minutes. This is a huge part. This is something we don't get funding for, and I am not special. I am just one of 15, 18 nurses who works on this palliative care unit, and I can guarantee you every single one of us do this. Every single one of us has this kind of a patient. And so I sat there with him, and I said, do you feel cold? And he said, I do. And one of my favorite tricks to do, and it was a donation, was to get a hot blanket from our blanket warmer. And so I went and I got him a hot blanket, and I tucked him all in. He said, oh, you always know what the right thing to do. And so I got him his hot blanket, and I tucked him in, and we sat and we talked a little bit longer, and I said, I tell you what, I said, I can't stay in here all day, but I will keep checking in with you every hour. Every hour I will peek in. I said, and if you're asleep, that's okay. I'm just going to put my hand on you. I'm not going to wake you up just to let you know that I was in the room, and then I'll go out again. And I kept my promise to him. So when he died, I was also there. And the whole family, I have never, ever felt such pain in a room. And his father was collapsed on his bed, sobbing for the lost time. And a room full of people who could never, ever replace the loss that this 47-year-old man has experienced. And they can't fill the void that they now realize that he will have left them. And so what could I do for them? Because that's what palliative care is I could sit and talk to them. And so I made a pot of coffee, and then I made a big pot of tea, and we sat down and we talked about what a privilege it was to know this gentleman, and what his strengths were, and what kind of drive he had, that the most important possession, and every one of our patients gets a TV with free cable and all of that. It doesn't sound like much. His big thing was he didn't want our TV. He wanted the TV he had bought himself with his hard-earned cash. And so we talked about that. And I thanked them. I thanked them for the honor of looking after him. And then my last gift for this patient was to wrap him. And so when everyone had said goodbye, I'm a very tearful kind of a person. When everyone had said goodbye, I put him in the shroud, which is a plastic sheet, and I talk to my patients until I cover them up, because they are still there as far as I'm concerned. So anybody who has had somebody who they've lost, anybody who has had a palliative care nurse in their lives, whether it's in the community, in KGH, St. Mary's, wherever it might be, I pray that they all do this for you, but I would guess that most of them do. So I talked to him, and I thanked him for letting me get to know him, and I washed him, and then I took him down to the morgue myself. And then I said goodbye, and I left the lights on because I didn't want him to be alone. That's what being a palliative care nurse is about. I'm going to leave you with this last vision. This truly has got to be the most painful one that I have ever felt. I would have been about 25. My patient would have been 27. She was black. She was from Africa. And she had a 10-year-old daughter. And she had got pregnant when she was 17. And she had emigrated over to Canada. And she had been diagnosed shortly after she was pregnant with brain cancer. And she couldn't have any treatments while she was carrying this baby because she knew that the baby would be damaged if not killed. And so she held off. And after her baby was delivered, she had intensive radiation and chemotherapy and surgery. She had to have a lot of debulking surgery. So she had horrific changes to her shape of her head and big divots. And because of the radiation and the chemotherapy, she was no longer able to swallow, so she had to have a feeding tube. And again, because of the growth of this cancer, she ended up having multiple strokes. And so she couldn't communicate very well. Well, when her daughter was very, very young, she knew that that was what Mommy was like. But as her daughter got older and went to school and she saw what other mummies were like, she didn't think that that was normal anymore. And she got angry with her mom. And I guess I would feel angry too if I were young and little. And so this little girl would sit on one side of the bed, and I'd sit in the middle, and her mommy would sit on the other side of the bed, and her mommy would ask questions about her day through me, and she would get answers about the day through me. And my gift to this little girl was to help her mom to write down all of her thoughts and wishes and dreams for her and put them in a memory box, so that after she had died, and when this little girl started to feel very, very remorseful and very sad about the loss that she had experienced, that she would realize that her mom loved her and that she understood and that she was there for her and that she had given the ultimate sacrifice for her. And I still think about her. And I mean, gosh, I'm 46 this year. I still think about that little girl. And I wonder how she's doing. That's what being a palliative care nurse is about. So I'm sorry for those of you who have been moved to tears, or I'm sorry for those of you who this experience is a little bit too close. But when you bring somebody in to St. Mary's, and I can only speak now from a St. Mary's perspective, I can tell you that your loved ones are treated as family, and that we care for them with respect, and we treat them with dignity. And even at the end, if you can't be there with them, we will sit beside them, and we will hold their hand, and we will help walk them through that next step. And thank goodness we have the Dr. Franks and the Dr. Stewarts and the Dr. Patys of the world who work so well alongside of the rest of the care team. But I can tell you that it's the family members that allow us that privilege. I'm always mindful to say thank you back, because it is such an honor to be able to help someone walk through this step. So I don't know if that's my time, but I thank you very, very much for giving me the opportunity to speak to you today.